Hi, my name is Dr. Sabrina Jacobs with Performance Equine Vets. We're here today to talk about premature foals. We're going to go over some of the physical characteristics that premature foals have, some of the behavioral issues as well, as why it's important to involve a veterinarian as soon as possible. We actually have a premature foal here today in the hospital, and we're going to go take a peek. This is the little filly I was telling you about. She's 2 days old today, and she came in shortly after she was born. She has some of the classic signs of being a premature foal that I wanted to go over. One is that she has quite a domed forehead. See how much rounder it is than a normal foal? It'll probably take 2-3 weeks before that actually levels out. She also has floppy ears, and even though she tries real hard every day, they still don't have quite the strength to stay up in an erect position. She's got a very silky, curly hair coat. You can see that here on her head the best. And she's about 50% of what she should weigh in her body. She should be a 90-pound foal today, and she's only a 45-pound foal. So with that, she's not got the strength to actually stand on her own. And so when we assist her, she can only stand for about 5 or 6 seconds, and then she gets weak and she needs to lay down again. She also has flexor tendon laxity, and what I mean by that is that when she's up on her hooves, her pasterns are actually touching the ground. And so she can't really hold herself up like she should. We're going to go over some of the things that we're doing to try to help her and to get her where she needs to be with the other foals. When we talk about a foal having a poor suckle reflex, what we're really talking about is their ability to ingest the milk. A normal foal would have a suckle reflex at about 30 minutes after they're born. This foal is 2 days old and she still doesn't have the suckle reflex. So she drips a lot of the milk out of her mouth and she tries to swallow. She's very eager to have some milk, but she's not very good at getting the quantity that she needs. A normal foal would ingest about 20 to 25% of their body weight. This foal with oral feeding is probably only ingesting 2.5 to 5% of her body weight at this point in time. So we have to help her a little bit. We do a bunch of different things like put the food in a tube that goes to her stomach to try to supplement part of the nutrition as well as the IV fluids. Now we're going to talk about the treatment options for this foal and how we're going to get her back to being a healthy foal. First thing is that her respiratory system isn't very developed. And because of that, she needs to have supplemental oxygen therapy. You can see the nebulizer here that goes to a tube that is in her nostril, supplies her with oxygen that she needs to meet the requirements that her tissues require. The second thing is that her digestive system isn't developed, and so she can't actually handle the milk quantity that she would need to ingest to meet her systemic requirements. So what we do is we have her on a pump, we have additives in the fluids to help meet some of those requirements, and we have her on a rate that delivers them at a specified amount per hour. The last thing is that her immune system is not very developed, and because of that, she needs to have broad-spectrum antibiotics. This is a really cool piece of monitoring equipment. It allows us to check the foal's blood pressure, temperature, and oxygen saturation. The machine will actually tell us when it's appropriate for us to decrease the amount of oxygen we're supplying the foal. This is a very important piece of equipment for us to use because it allows us to treat the foal as we need and to make special adjustments. We're going to continue to treat the foal for probably the next 1 to 2 weeks until the foal is stable enough to not require assistance on its own. We first looked at this foal on the farm when the owners called me out as they recognized that the foal was unable to stand and nurse. We determined that the foal was premature, would not survive on its own, and would need additional support, so we decided to bring the foal to the clinic for treatment. Today we've covered the signs of a premature foal. If you see any of these signs in your foal, please contact your veterinarian as soon as possible so that an early intervention can be made. Our goal is a happy, healthy foal. Thank you for joining us.